When I started at Regeneron, the space I worked in had a name that sounded much nicer than it actually was. It was called the Skybox, and it was not a corner office. It was a work trailer built on risers in the warehouse above the loading dock. And when trucks backed in, my desk would shake. You could feel the doors rolling up and the pallets moving beneath you. Rain, wind, snow, it didn't matter. The Skybox was a building inside the building, sealed off from the outside world, except for the rumble of the freight moving below. I spent my time there typing part numbers into a system. At the time, the work felt small. But sitting in that Skybox taught me something. Getting medicine to patients isn't abstract. It's physical. It moves. It has deadlines. And sometimes, it shakes your desk. Most people think about manufacturing as discrete assembly. If you're making a bike, you need 2 wheels, a frame, some handlebars. But what we do at Regeneron, up at IOPS, is different. It's alive. We grow living cells. We keep them warm. We feed them. We clean up their waste until there's enough of them to produce our medicine. Picture a swimming pool of biology. And then we filter it all away, the cells, their food, their waste, till all that's left is our drug. And we put a precise amount into a vial without introducing a single germ. But here's the thing that people don't think about. That vial of medicine isn't ready for a patient yet. Before it can move anywhere, it has to be released, which means that teams need to review every manufacturing record, pass every QC test, perform every quality check to say that the batch is safe. That's not paperwork, it's proof. And the fact of the matter is, we can do everything right and still get nothing, because biology is not like making bikes. That's why systems in our world are engineered to eliminate risk to the patient. Safety stock for critical components, sensors to track temperature, systems to trace every vial, rules that stop progress the minute something doesn't look right. Patient safety is our cost in doing business. But we have another principle that is equally important. Never short the market. In a typical supply chain, if a company stocks out, the consumer can just buy something else. But in our world, if we stock out, a patient doesn't get the medicine that their life depends on. That's not a business problem. It's a human one. Now, I'm not a scientist, but I grew up in a science family. My dad's lifetime in life sciences started cleaning animal cages in a lab. Dinner conversations weren't about my homework. They were about gene knockouts and research targets. And Regeneron was on the horizon. Not in my life yet, just as a place I drove by on the way to high school. And when I went to college, I studied finance because cleaning animal cages was not an appealing first job. But when I needed an internship, Regeneron just felt right. I had no idea I'd still be here more than 12 years later. A few years into my career, Regeneron opened a site in Raheen, Ireland. I got to go and help set up. When I arrived, the manufacturing area was a maze of plumbing and wires. And the warehouse? The warehouse was tape on the floor, outlining where walls and freezers would someday be. But I was there, setting up its digital twin, configuring a system to track medicine that we hadn't produced yet. And that's important because today that site has more than doubled our manufacturing capacity. More than a decade later, in 2023, Regeneron made another decision that changed everything. For years, we had discovered medicine, produced it, and then handed it off to partners to distribute. That worked when we were small. But as we grew, we wanted to hold the pen. We believed more fiercely in our medicines than our partners did, and it was time to make a change. We wanted not only to discover those medicines, but to be able to distribute them to patients around the globe. That project had a name, Project Magellan. Magellan's expedition was the first to circumnavigate the Earth. It took him nearly 3 years. We were given 18 months. 18 months to establish a global distribution capability from scratch, with no margin for error, because we already had patients on therapy, and we couldn't be the reason that they went without their medicine. It seemed like an impossible task, a journey into the unknown. And the joke on the team was that Magellan himself never completed his voyage. He died along the way. Only one of his 5 ships, led by his navigator, completed the journey. I worked on the order to cash team, just one of many teams that came together for this initiative. Our job was to set up systems to track who was ordering, where the medicine was shipping, and how we were collecting payment. Behind that was a huge puzzle, because we had 41 different markets, and Regeneron is not one legal entity on paper. So we set out by doing something that Magellan's navigator would have done. We mapped. We mapped the physical flow, where the product was shipping. We mapped the financial flow, what legal entity was owning it, selling it, and collecting payment. We started by mapping 41 markets because we thought we had 41 problems to solve. But as we started to overlay those maps and look at the requirements, we discovered something surprising. We could group markets together into what we called patterns. And it turned out that there weren't 41 problems to solve, there were only 5. If we could solve those 5 problems, we could sail around the world. We embarked in stages. Canada was first because it had its own setup. Then it was on to Germany, which unlocked most of Northern Europe. Then the UK, France, Italy, Spain, South America, and finally, Japan. Japan was the most unique because they require final packaging in market, which means we had to set up a new packaging site in addition to the in-market distribution. Different rules, different languages, different time zones. The same ticking clock. As we sailed back into the harbor, we had done something unprecedented in our industry. In 18 months, we had established 8 new distribution facilities, launched in all 41 markets, and we didn't miss a single order. But here's what I'm most proud of. Project Magellan didn't just move one drug. It charted a course for future medicines to follow. What I didn't understand back when I was sitting in that skybox is that none of that would have been possible if each member of the team didn't understand how their small piece fit into the bigger picture. Project Magellan wasn't successful because of some heroics in the final hours. It was successful because hundreds of people came together from around the world to do their small piece, to build systems that nobody ever sees, to map product flows that seemed boring on the surface, but were life critical when we were getting medicine to patients. That's what line of sight gives you. When you can see how your work fits together, it inspires you to take on the challenge. When I reflect on my own career, I can see how all the small pieces came together for me. As I grew, Regeneron grew. We went from 1 medicine in 1 country to 14 medicines, 2 manufacturing sites, and a worldwide reach. All of the small pieces, the systems, the processes, the integrations. My fingerprints are on some of them. So are thousands of others. At the time, I had no idea that I was helping lay the foundation of something that would be global. Sometimes I think back to that skybox, the work trailer in the warehouse. My desk doesn't shake anymore, but the work still does. Because it's not freight moving under my desk, it's medicine moving through systems that I helped build to patients who are waiting. And somewhere out there, right now, in the room or on the stream, One of you is doing a job that felt just as small as mine did back then. Typing something into a system, verifying an entry, running an assay. What I've come to learn is that if you can see how your small piece fits into the bigger picture, and if you can draw a line from what's on your screen, or in the lab, or on the floor, to a patient receiving their dose of medicine, everything changes. You work faster, you speak up sooner, and you build for scale. Because the work isn't small anymore. It's mission critical. Thank you.